You're walking along the trail in the summertime, and you're enjoying the sunshine and glad that we can finally be outside again. All of a sudden, you have a sharp pain in your leg, and you look down and something's slithering away in the grass. You've just been bitten by a snake. Do you know what to do? Do you apply a tourniquet? Do you wait and not move and just wait for help? Today, I'm here to educate everyone on how to properly take care of a snake bite, first aid. So worldwide, over 5 million people per year get bitten by a snake. And of that, 100,000 suffer from severe complications. This can range from shock, cardiac arrest, and even death. In the United States, there are 50,000 cases of snake bites per year. And of those 50,000, 7,000 are venomous. So with snake bites, you want to treat all of them as venomous. And venomous snakes have certain things in their venom that makes them toxic and affects the body. Here are some traits of some toxins in snake venom. One toxin is phospholipidase A2. This affects red blood cells, causing them to clot up. It affects the blood vessels, and that can actually lead to pulmonary embolism, a heart attack, and stroke. It also affects the muscles, the peripheral vessels, and some peripheral nerves. Another toxin is hydrocolonase, which is an enzyme responsible for edema, blistering, and necrosis. Neurotoxins cause paralysis, and polypeptides cause systemic toxicity in major organs, which can lead the body to go into shock. It's important to recognize these symptoms, call 911 immediately, and begin first aid. Recognize what to do and what not to do, because it can be the difference between life and death. Some symptoms of venomous snake bites include the actual bite, which is like a bloody wound discharge with blood clotting, the characteristic 2 indents in the skin, the fang marks, and then this can cause the swelling, the redness, obviously the pain, and some bruising. Some systemic symptoms that occur with snake bites are diarrhea, nausea, vomiting, excessive sweating, thirst, a rapid pulse, dizziness, weakness, and fever and blurred vision. From here, the symptoms can progress into deadly systemic-wide symptoms. These include an altered mental state, shock, paralysis, and difficulty breathing. What to do when you're bit by a snake? First things first, call 911 as we talked about before. And you want to begin to immobilize the area that you were bitten and keep it lower than the area of the heart. This will prevent it from going systemic throughout your body. It'll keep the blood flow minimal to that area. You want to remove all rings, necklace, tight clothing from the area, because once it swells up, that's going to cause circulation issues and you could lose the limb. If possible, you can wash the area with soap and water. And you can also circle the bite wound, mark down the time that it happened, and you can then cover the bite with clean, dry gauze. You don't want to wrap it. You just want to kind of keep it there. Don't make it tight at all. You want to remember the type of snake, noting its characteristics, and if possible, take a picture of it. During this entire process, you want to monitor your symptoms, how you're feeling, your breathing, your heart rate, and your level of consciousness. Some things not to do, which some of these things were actually common practice before we got the proper research on what to do for snake bites. These include: do not pick up the snake or trap it. Do not wait for your symptoms to appear. Call 911 immediately and immobilize the area immediately. Do not apply a tourniquet. Do not try to suck the venom out. Do not apply ice. Do not take any pain relievers that you may have, and definitely do not drive yourself to the hospital because you could pass out or go into shock and, die. So this is the reason you never want to apply a tourniquet. You can see here the line of demarcation where someone had applied a tight tourniquet, and then the venom kind of sat in this limb and caused the limb to die, and this patient actually ended up losing their limb. Once you're in the hospital, you'll go to the emergency care room, and first things first, if you are struggling breathing, they're going to do airway, breathing, and circulation. That includes, if your heart stops, doing CPR. If you're in respiratory distress, you can get intubated, applying oxygen, and then the first thing a nurse is going to do is apply a large bore IV to get fluids into you, because this will help prevent shock. And then the practitioners will do an investigation on what type of snake bit you, especially if you took that picture in the beginning. They'll be able to match the snake with the proper anti-venom. It is the only effective antidote for the venom, and it has to be specific to the type of snake or the type of poison that the snake has injected you with. Some barriers to getting this anti-snake venom is the high cost, the lack of availability, difficulty in identifying the snake type, and if the anti-venom is not specific to the snake, it can produce serious side effects such as anaphylaxis, pyrogenic reaction, which just means your body goes into a hyper fever, and that can lead to neurological death, and serum sickness, which is just like getting the wrong blood transfusion. When administering this, it typically takes over 24 hours to do this, and it should be given within 4 hours of the snake ideally, but again, it can be administered within 24 hours. With the warm weather coming up, it's important to know what to do if you're bitten by a snake. People are traveling, spending more time outdoors, and it's important to know the right steps to take to protect yourself. Proper first aid can slow the effects of venom and save your life.